Hi all, welcome to Physio Exam Buddy. This video is on intermediate and long-term regulation of BP. Short-term regulation of BP has already been uploaded in our YouTube channel Physio Exam Buddy. By watching this video, you will be able to answer questions like intermediate term regulation of blood pressure and long-term regulation of blood pressure. First, we will see the intermediate term regulation of blood pressure. The intermediate mechanisms come into play after several minutes of acute pressure changes and it reaches full function within a few hours. So, the intermediate term regulatory mechanisms operates within minutes to hours of the acute pressure changes. And these mechanisms may last for days. And most of these mechanisms, they try to control the alterations in the blood pressure by altering the blood volume. And the intermediate term mechanisms include renin-angiotensin vasoconstrictor mechanism, capillary fluid shift mechanism, and the stress relaxation and reverse stress relaxation. So, these intermediate term regulatory mechanisms, they respond to acute pressure changes within minutes to hours and their action lasts for days, and these mechanisms control blood pressure mainly by altering the blood volume. First, we will see the renin-angiotensin vasoconstrictor mechanism. Renin is a hormone which is synthesized by the juxtaglomerular cells of our juxtaglomerular apparatus of the kidney. Whenever the arterial blood pressure falls, there is an increased release of renin into the blood from our juxtaglomerular apparatus. And this renin, it converts angiotensinogen into angiotensin 1, which is again converted into angiotensin 2 by an angiotensin converting enzyme which is secreted from the lungs. This angiotensin 2 is a potent vasoconstrictor which can increase the blood pressure. And this angiotensin 2 can also act on our adrenal cortex and it can increase the secretion of the aldosterone. This aldosterone will cause an increase in the renal retention of the salt as well as water. So, angiotensin by itself is a potent vasoconstrictor and by increasing the aldosterone, it also causes increased renal retention of the salt and water, thereby increasing the blood pressure. And this angiotensin 2, it acts as a potent vasoconstrictor, thereby increasing the blood pressure by different mechanisms of action. So one of the mechanism is that it will facilitate the release of norepinephrine by a direct action on our postganglionic sympathetic neurons. And another action of angiotensin 2 is that it causes contraction of the mesanglial cells with a resultant decrease in the glomerular filtration rate. It also got a direct effect on the renal tubules to increase sodium as well as water reabsorption. And it acts on the brain mainly in the area postrimum, and it actually decreases the sensitivity of our baroreceptor reflex, and this can also potentiate the pressure effect of the angiotensin 2. In addition, it acts on the brain to increase the water intake and increase the secretion of the vasopressin and ACTH. So, by all these mechanisms, it will increase the blood pressure back towards the normal. Second mechanism coming under intermediate term regulation of blood pressure is capillary fluid shift mechanism. When the BP is raised, the mean capillary pressure is also high. And this results in the shift of the fluid from the circulation into the interstitial fluid compartment. This will reduce the blood volume and restore the blood pressure back towards the normal. And whenever the BP decreases, the exact opposite happens. That is, the mean capillary pressure is low, resulting in the absorption of the fluid from the interstitial compartment to the circulation. Thus, the blood volume is increased, which helps to return the blood pressure back towards the normal. And the last mechanism of the intermediate term is the stress relaxation and reverse stress relaxation. This stress relaxation, it is a property of the smooth muscle, and it refers to vasodilatation occurring due to the stress on the vascular smooth muscles. So whenever there is an increase in the blood pressure, there occurs stretch in the blood vessels. This continuous stretch will result in relaxation of the blood vessels by vascular tone adjustment and resulting in a fall in BP. And the reverse stress relaxation operates when the BP is low. That is, whenever the BP decreases, it will causes only less stress on the vessel walls, causing the tightening of the blood vessels by vascular tone adjustment, trying to restore the blood pressure back towards the normal. Next is the long-term regulation of the blood pressure. And it takes hours to show any significant response, and these mechanisms operate very powerfully to control the arterial pressure over days, weeks and months. In long-term regulation of blood pressure, the kidneys play the main role, and that is by either direct mechanism, that is the renal body fluid pressure control mechanisms, and an indirect mechanism, that is mainly hormonal, by the action of renin, angiotensin and aldosterone mechanism. So first we will see the direct mechanisms, that is renal body fluid pressure control mechanisms. So these long-term mechanisms, they act within hours to days to months to bring back the BP back towards normal. And out of this, the kidneys actually play a main role in the long-term regulation of the blood pressure by direct as well as indirect mechanisms. So first about the direct mechanism, that is renal body fluid pressure control mechanisms. This can also be explained under two headings, that is pressure diuresis and pressure natriuresis. First we will see what is this pressure diuresis. When ECF volume is increased, the blood pressure rises, and this increase in pressure has a direct effect on the kidney to excrete more fluid and return the pressure back towards the normal. Now we will see what is this pressure natriuresis. Increased secretion of water as well as sodium will occur whenever there is an increase in the blood pressure, and this will bring back or return the BP back towards the normal. And whenever there is a fall in blood pressure, kidney reduces the excretion of the sodium and water, and again increasing the BP back towards the normal. Now we will see the indirect mechanism, that is hormonal regulation of the blood pressure. So it can also be asked as hormonal regulation of blood pressure. So if hormonal regulation of blood pressure is asked, you have to explain the hormonal regulation under these headings, that is renin, angiotensin, aldosterone mechanism, aldosterone, ADH as well as ANT. First, we have already seen the renin, angiotensin, aldosterone mechanism in the first part of the video. So just explain that. That is, whenever there is a decrease in BP from the juxtaglomerular apparatus, renin will be secreted, which will convert angiotensinogen into angiotensin 1, and this angiotensin 1 is converted into angiotensin 2 by an angiotensin converting enzyme which is present in the legs, and the angiotensin 2 is again a potent vasoconstrictor. Also, it acts on the adrenal cortex to increase the secretion of the aldosterone, which causes increase in the renal retention of the salt and water. So by these two mechanisms, it will increase the blood pressure back towards the normal. Next about the aldosterone. Aldosterone, it increases the reabsorption of sodium and water, which expands the ECF volume. And this increase in the ECF volume will cause an increase in the blood pressure. In addition, this angiotensin 2 also acts on the brain to increase the water intake and increase the secretion of vasopressin and ACTH secretion, finally bringing back the BP back towards the normal. Next, we will see what is the effect of the ADH in the control of BP. When the blood volume is increased, impulses from the low pressure receptors, that is those present in the great veins as well as in the right and left atria and the pulmonary vessels, they pass via the vagus nerve to the nucleus of tractus solitarius. And from the nucleus of tractus solitarius, an inhibitory pathway projects to the caudal ventrolateral medulla. And there is a direct excitatory pathway from this CVLM to the hypothalamus, which decreases the secretion of the ADH from the hypothalamus and restore the blood volume and BP back towards the normal. Now we will see what is the effect on the ANP, that is atrial natriuretic peptide, on blood pressure. ANP secretion is increased whenever there is an increase in the ECF volume. That is, whenever there is an increase in the ECF volume, it will cause the stretch in the walls of the atria, and which will cause an increase in the secretion of the ANP, and it will promote the natriuresis and appear to be involved in lowering the blood pressure. And the actions of ANP for decreasing the blood pressure include: first one is that it will increase the sodium excretion by acting on the kidney. That is, it appears to produce this effect by dilating the afferent arterioles as well as by relaxing the mesangial cells. So, both these actions will produce an increase in the GFR, thereby reducing the blood pressure. In addition, this ANP can also act on the renal tubules to inhibit the sodium reabsorption. Other actions include an increase in the capillary permeability, leading to extravasation of the fluid and decline in the blood pressure. In addition, it relaxes the vascular smooth muscle in the arterioles and venules. It also inhibits the renin secretion and counteract the pressor effects of catecholamines and angiotensin II. Thus, BP is regulated mainly by neural as well as hormonal mechanisms. So, to summarize, BP regulation includes short term, intermediate term and long term. Short term acts within seconds to minutes, intermediate term within minutes to hours, and long term within hours to days. And short term include baroreceptor reflex, chemoreceptor reflex, and CNS ischemic response, whereas the intermediate term include the renin-angiotensin mechanisms, stress relaxation, as well as the capillary fluid shift mechanism. Whereas the long-term mechanisms, that is, which operating from hours to days, include mainly our renal, blood, volume, pressure control mechanisms, as well as the hormonal mechanisms. Thank you for your patient listening, and keep on watching Physio Exam Buddy, which makes your physiology exams more easier.